Okay, today we're going to talk about shoulder injuries, and when you're dealing with athletic injuries, shoulder is definitely one of the more common injuries that you're going to see. With athletic injuries, definitely the knee and the ankle and the shoulder are included in that group. And with the shoulder, depending on what type of sport you're playing, it can be a very common spot to have an injury. And within the shoulder joint itself, there are many different aspects of the shoulder that can become injured and different type of injuries that you can have. The shoulder in itself is a very difficult structure to evaluate because there is a lot of anatomical parts there, a lot of different moving parts. The shoulder is a very unique joint because it's a ball and socket type joint that allows a full 360-degree range of movement with the shoulder. That is good as far as the type of movements and activities that you may need to do in certain sports like throwing or tennis or swimming or something like that. So the advantage is there's a great deal of movement. The disadvantage is with the increased mobility you have decreased stability. So the shoulder just in itself is not a very stable joint. And if you look at the poster here, we're talking about a ball and socket joint, and I always describe it in the same way. Just think about a golf ball sitting on a tee. That right there just is not a very stable situation. I mean, the golf ball can easily fall off the tee, and if you look at the shoulder, the anatomy, the main part of the anatomy, the glenohumeral joint, the head of the humerus is basically the golf ball, and the glenoid fossa is basically the tee. So that's how you get a full that type of a ball and socket joint with full movement is you have a ball and socket type joint. So if you look at the bony anatomy, there's several things to keep in mind. You got the humerus bone, the scapula bone or the shoulder blade, the clavicle or the collarbone in the front, and I'd like to note that the clavicle and the scapula kind of hook together to form the AC joint. So you have several joints within the shoulder, and that leads to more possibility of injury. Now, the difference that I see with shoulder injuries is I'm working on a younger type population. They're going to have more of like a tendonitis type injury going on with a muscle and a tendon. But probably if I had to sum it up, the most common shoulder injuries that I see are in particular like an inflammation type thing.